Good morning, good afternoon, hello wherever you are. My name is Gretchen Alkema, and I serve as Vice President of Policy and Communications for the SCAN Foundation. Delighted to welcome you to today's webinar, Shining a Light on State Progress, speaking about the Pacesetter Prize that is awarded from the SCAN Foundation in 2020. And I'm so excited to hear from some amazing panelists that we have today. Isilda Dickerson from Ohio, Greg Olson from the state of New York, Carol Grant from New Jersey, and Don Lambert from Connecticut. Today we're discussing how states can improve long-term services and supports so that older adults, people with disabilities, and family caregivers can live well in the place that they call home. Since 2011, the SCAN Foundation has supported development of the AARP Long-Term Services and Supports State Scorecard. Over 4 rounds of this scorecard, we've seen modest improvements across all states. However, as our population is aging and communities are rebuilding from challenges that they face with the coronavirus, we face an even greater need for high-performing systems of care to serve those with those daily needs and focusing on home and community. Using data from the AARP scorecard, we at the SCAN Foundation awarded 4 states, these 4 states, a Pacesetter Prize. Through this prize, we honor those states making significant progress, highlighting activities where state efforts have had positive, measurable impact on their residents and on their communities. In 2020, the Pacesetter Prize award-winning states represented here with our awesome panelists are Connecticut won the prize for affordability and access, New Jersey for choice of setting and provider, New York for support of family caregivers, and Ohio for effective transitions. I congratulate our Pacesetter Prize winners for their success over the past several years, as well as their ability to move forward with courage, collaboration, and creativity in this pandemic era. As I'm joined by the representatives of each of the Pacesetter Prize winning states, I'm really excited to hear their experience, strength, and hope in these really challenging times. So before we get started, I'm going to go through a few housekeeping items for all of you in the attendee audience. During this webinar, you may submit your questions at any time through the Q&A button that's at the bottom of your screen. Please start and contribute to the conversation on Twitter or LinkedIn using the hashtag Pacesetter Prize. All one word squished together. We'll put that in the chat for you as well. And please know that a recording of this discussion will be emailed to you and made available on the SCAN Foundation website in a short period of time. Our website is www.thescanfoundation.org. That'll also be in the chat. Before we get started with our panelists, we'd love to learn a little bit more about you. So please see the poll that's going to come up here in just a moment. And we'll see who is part of the webinar. I'll click on myself. I'm going to do other as the foundation. Oh, I guess I can't vote, but we're going to hear from you in just a moment. I look forward to our results. And as that's coming together, we'll see who's with us in just a moment. I'm really delighted that we're first going to start off with hearing from Don Lambert from the state of Connecticut. And with that, Don, I'm turning it over to you.
Thank you, Gretchen. Thank you for the introduction, and thanks to the SCAN Foundation for putting together this webinar that really highlights some of the activities of states and highlights an important emphasis on people who are older adults, people who have disabilities, and their caregivers living their best life. And I think that's one of the things that stood out to me about the SCAN Foundation's focus on today and on these important activities is helping people live their best lives, no matter where they are and the services that they receive. Gretchen asked that we answer 3 simple questions. One is what does the award for access and affordability mean to the state of Connecticut? 2 is like, how did we excel at these things and how are we doing? And the third thing is just an example of a couple of activities. first and foremost, what it means for the state. And I'm honored to be part of this, to be representing the state and representing our governor today, especially on the award of access and affordability. For us, in short, it just means inspiration. Now, what I mean by that is it inspires us to do more. The fact that we've received an award, it causes us to pause for just a second, but just to in that second, re-energize us towards more activities and doing better with the common goal of improving services for people who need long-term supports and services, older adults, people with disabilities. In terms of how we've done it, we have a couple of quick summaries of how we do it. One is partner with diverse stakeholders. First and foremost, we partner with the Nursing Home Association. We partner with people with disabilities and older adults. And we have a steering committee that has interagency representation, and we meet on a regular basis. So it's not even a once a quarter kind of event. It's constantly listening to all of our partners and to the people that we serve. And for any of us who at any point need to be grounded in what we're doing and how we're doing and how we're not doing, it's best to ask the people that we serve directly, and we will definitely get some direct answers, and it will help us to understand how much further we have to go to that future vision state that we have, where people actually across the board have access. We do have common focus on choice and autonomy, and led by the idea that all people should receive services in a dignified way, should be treated with dignity and respect, that they should have autonomy in decision-making. And in order to do that, they need to have choice. And that's why the award of access is so important, because if people don't have access, they don't have choice. So last, as far as how we do it, we do develop a plan. And then frankly, we learn from other states. And once again, I applaud this opportunity to learn from the other states here and from all of you on the webinar about what other states are doing. A long time ago, somebody said to me, you know, if you think you have a creative idea in this space, do a literature review. You'll find out somebody did it before you did. And we want to learn from those practices so that we can improve and make it a little bit better. In terms of programs, everything that we do is led by data. We have, I would say, one of the most important things we did a very long time ago was establish data, methodology, and benchmarks. We report on those in a transparent way with the help of University of Connecticut. We do that. We also partner with other contractors to do supply and demand projections. We have to know where we're at, and we have to know where we're going so that we can create some exciting interventions. We just very recently, we're about to release our housing projections by community. Why? Housing's important. If people don't have access to housing, they don't have access to services in the community, and they don't have access to choice. So that's an example of what we're about to release at a community level so that our partners can also help with it and initiate services, initiate action at a local level. Because it's not just what happens in state policy, obviously, or in federal policy. It's about what happens with local communities, and our ability to partner with those individuals at a local level is absolutely a strategic priority. We also have a focus on transition, once again, choice. We want to make sure that people who have entered a nursing home for whatever reason understand that they have a choice to go back to community, just as people in community understand they have a choice to remain there. Access to information is actually foundational to that, making sure that people know they have a choice and creating access to those choices. Lastly, in our transition program, we have moved out about 7,000 people so far. We are a recipient of Money Follows the Person. We've learned a lot about those activities, from the gaps that exist in the system. And when we identify a gap, we create an intervention. And that brings me to the very last activity, which I'm just going to comment on briefly, and that's community first choice. We were a state in 2015 that did not have personal care attendant services in the state plan. Community first choice for the first time offered people an entitlement in our state in lieu of institutionalization. So if individuals are at nursing home level of care, they have choice of community first choice, or they have choice of a nursing home. Either one, we want to make great quality choices. But through community first choice, we have been able to increase the workforce because of that emphasis on an ability for the person to be able to hire someone who is a family caregiver. And with that in mind, data once again is important. We've increased the workforce from back in 2014, right before we started, with a workforce of personal care attendants in the state around 2,400 to today, 5 years later, almost 6 years later, we now have 14,000 personal care attendants in the service. So once again, data is important to everything we do. Stakeholdering and partnering so that everybody's on the same page, creating a common vision is exponential results. And then last and probably most importantly, listen to the people that we serve to stay grounded and to make sure that what we're doing is really mattering and really on point. So thank you very much, Gretchen.
Awesome. Thank you so much, Don. Partnerships and leveraging federal opportunities sounds key and really powerful information. And so next up, delighted that we're going to hear from Carol Grant from the state of New Jersey. Carol.
So much of what Dawn said, I'm going to highlight in what I'm saying as well. And I'm so thrilled to actually be part of the dialogue today with other states that are being recognized for their efforts in improving LTSS in the community. Although we are recognized for two things, which is really progress in improving member choice of setting and in providers, all of the elements really, that are represented by those who are on the panel today are important to us and have been part of our solution. And, just as Dawn said, I'm listening to pick up tips for how to do it better, because that's really the paradigm and the North Star that we have. New Jersey's been long known for having really effective partnerships with stakeholders. We're a small state. If you're really not happy with us, or even when you are, you could actually go about 2.5 to 3 hours and be from one end of the state to the other. But they also, our stakeholders bring, innovation, they bring commitment, they bring influence with governors, with legislatures. And therefore, when you are really supporting a program as important as this one, they really help, move and sustain our efforts going forward. I think when we launched our Managed Long-Term Services and Supports program in 2014, about 30% of our population was in home and community-based settings. By 2018, this rose to nearly 50%, and we continue an upward trajectory. In our early stakeholder meetings, our steering committee, with whom we partnered to establish, develop, design, and implement this program, this was really an early North Star. And this is where it expected to be, to have people living, maintaining connections in the community as long as possible. And we have worked all of these years to make sure we're sustaining those efforts. We have many ways that we do that. We have promoted our Pca Self-Direction Program. This has been extremely effective for us, especially during the 11 months of our public health emergency, when circumstances negatively impacted the availability of agency personnel. Our self-directed option gives maximal flexibility and choice of worker, and has grown from an initial enrollment when Medicaid assumed responsibility for the program of about 9,000 enrollees to almost 20,000 over the last 2.5 years, with a lot of the growth happening really during the public health emergency. Our eligibility has been expanded for this program to include caregivers in the developmental disabilities IDD community to participate as paid workers in our personal preference program. We would really like to continue that in the future. It has been very effective, even as we had workforce shortages on the agency directed side. And another thing that we did was we really made it a priority to try to support community living, community-based living as much as possible. We eliminated a monthly cost cap for home and community-based services, which really does support greater choice in long-term care settings and in choice of providers. The state may approve requests for home and community-based care delivered at home or in the community, even when those costs exceed an institutional cap. This was a flexibility provided in our 1115 by CMS, for which we are very grateful. We have an interdisciplinary team that actually treats each individual person who is in this kind of situation and to make sure that they receive services in the least restrictive settings appropriate to their needs. While cost is considered, health and safety remain uppermost in the state's decision-making, and every effort is made to continue to support community-based living to the maximum extent possible. We participate, we try to keep our fingers on the pulse of what's going on in the field. Very easy to, data is very critical. We use it, we need it, but we also want to touch base with the members of our MLTSS program. We want to actually talk to them directly. We have participated for the last few years in the National Core Indicators for Aging and Disabled survey process, using state employees trained by NCI to make sure we have conflict-free listening. This approach has really helped us to improve person-centered planning, options counseling, and to ensure that we are in fact maintaining individual choice in the delivery of LTSS services. The survey goes beyond just satisfaction to experience in the program, which I think is really what has enabled us to continue to do improvement, drive improvements, and have enrollees and members at sort of the focus of how we do that. We also have a requirement in our contract for care management that provides a full range of options to support member choice and needs. And care managers really coordinate both acute, long-term services and supports and behavioral health services, and considers social determinants of health to allow individuals to remain home and community as long as is possible. It also has enabled us to achieve effective transitions from institutional settings to the community as appropriate. Effective care management, we really do believe, is one of the most important tools in our ditty bag. In addition, New Jersey operates a Jersey Assistance for Community Caregiving program known as JAC. This program provides people ineligible for Medicaid with access to HCBS. And why is that important? Because it, in fact, may delay the need for institutional care, which may delay the need for Medicaid, and really maintains community connections. You know, our goal here is to continue to support HCBS, to sustain our partnership with the federal government around Money Follows the Person. We're very happy to hear that that program will continue for another 3 years with some additional flexibility. It has really been critical to enable nursing home and developmental center resident transition into community-based settings. And we will continue to be collaborating with stakeholders to elicit proposals for how we do this better. We have a long history of this and we intend to continue that partnership. The one thing about LTSS we have found is that it really does take a village to raise an MLTSS program. You can't do it alone. You know, our effective partners with our Division of Aging Services, with our Department of Health, with our Division of Children and Families, because our LTSS program does have some children who may have skilled needs. That partnership will continue, and we continue to look at solutions for both formal and informal caregivers. We're particularly interested in how we do a better job of supporting caregivers. The emergency, public health emergency we've been living under for 11 months has taught us that all of those things we thought we could never do, we actually have done. And it has enabled us to really continue to divert people out of long-term care, facility-based kind of an operation, and to, in fact, return them to home with appropriate supports. And we want to continue to do that.
I love that, Carol. That's so powerful. And we're going to get into that in the Q&A for sure. So good. Awesome. Thank you so much. And collaboration is key, is what I heard. And look forward to our discussion. Greg from New York, let's hear it. Tell us about your experience with the support for family caregivers and the Pacesetter Prize.
Definitely. Oh, great. Thanks, Gretchen. I want to first thank you and everybody at the SCAN Foundation, AARP National. I want to thank our state partners, our county partners, all the community-based organizations in New York that really have pulled together to support caregivers. I would be remiss without calling out Beth Finkel and AARP New York and her amazing team, our friends at the New York State Health Department, particularly my staff that work on this, Dina Press, Jennifer Rosenbaum, and Aaron Purcell. And congratulations to New Jersey, Connecticut, and Ohio. I'm really proud to be here on behalf of New York State to accept this award. So what does this prize mean to New York? First, I got to put a little context on it. Any given year, we have 4.1 million caregivers that support people of all ages to do a variety of things. So we know how important the role of family caregivers are: friends, neighbors, spouses, adult children, grandchildren, in supporting folks, both in terms of their healthcare impact, long-term care, staying connected to the community, and all the things that people do. Absent those caregivers, it would cost about $32 billion extra in Medicaid for additional services and supports. So what this award really does in terms of where we come from, New York, is really recognizes, first of all, the incredible leadership of Governor Cuomo, who basically charged the states in many of the things that we do with developing a comprehensive multi-agency and systematic plan to address this issue, among other issues as well. So I think the examples that I want to give in terms of some of the things that we've done shouldn't be viewed in, a lens of particular programs and services that don't connect, but much more of a systemic, integrated, cross-systems approach, both at state and the local level. Because I think for many of the challenges that we face across the board, you almost need an enhanced team to make sure that these things get addressed. And that's the lens that, that I view this out of. So specifically, New York State's prevention agenda, which is our 5-year public health improvement plan, our health across all policies approach, which is how you engage and who you must engage, which is broad-based to improve public health. And of course, New York being the first age-friendly state in the nation, and now we're implementing age-friendly health systems, all embeds the role of caregivers, both in terms of planning and procurement. The governor a couple of years ago signed Executive Order 190, which directs all state agencies to build elements of the prevention agenda, health across all policies, age-friendly, smart growth, livable community principles into planning and procurement, including, again, caregiver supports. We passed a few years ago the CARES Act, and was signed by the governor, which is different than the stimulus money, which really requires hospitals to identify and document who caregivers are and work with those caregivers to assure, as well as the patient or the individual, good outcomes and good discharge planning. We have the nation's first and most advanced paid family leave program. The Department of Health gets a $25 million annual investment to support caregiver and respite services for individuals with Alzheimer's and other cognitive impairments. Many of those grantees work with our area agencies on aging. We've had investments from my agency into expanding statewide and training peer-to-peer respite providers so that we can, again, increase capacity. We've had significant investments in my agency to address unmet need. Those are things identified at the community level, services that are needed but not available, and that both aids caregivers as well as care receivers. We are implementing the evidence-based T-Care model out of Washington, the state of Washington, which helps to identify pre-burnout those issues that make it difficult for caregivers to continue what they're doing, provide those types of community supports to stop in progression the burnout. We are working with the Department of Labor on developing and putting out, which will be hopefully within the next couple of weeks, a caregiver guide for businesses. Look, caregivers are working. It costs businesses a lot of money in terms of lost productivity, turnover, tasks that need to be completed while you're on the job. So when we talk about businesses in New York, we're not talking about the private sector, we're talking about the public and the private sector. And it really is an all hands on deck approach. We've provided enhanced training for caregivers and care providers. We're implementing new initiatives like bringing the virtual senior center to individuals. We are known here in New York for our animatronic pet project to combat social isolation that has a huge impact on caregivers, as well as additional transportation options. We're going to be working with the University of Wisconsin in the next couple of weeks to launch a broad-based business initiative, again, including the public and private sector, to really get a handle on what the impact of businesses are on working caregivers, very similar to what was done nationally by the MetLife Mature Market Study years ago that showed tens of billions of dollars in lost productivity, turnover, absenteeism, et cetera, because of caregiving. We have a very robust, through our ADRC, which is New York Connects in New York State, searchable database of a variety of programs and services to help people meet their needs at the community level. Our respite and caregiving alone has over 76,000 local providers in it. So getting people connected to that. And then, of course, one of the things that I love is we support both through grant money, the Village to Village network to begin to seed villages. But we stood up the only national regional village technical assistance center to create an entity that can help those communities that want to develop a village movement actually go from A to Z. So on behalf of all of the entities, individuals, state agencies, private agencies that are involved in any of the things that I mentioned, I really humbly accept the award on behalf of all New Yorkers, and can't thank again the leadership of the governor that really requires us, and rightly so, to not be turf oriented, but to utilize the assets of all of us to do the work that we need to do in better times, but more importantly, in difficult times.
Right. Right. Wow. That's super powerful. I love the message of kind of health across all policy areas, Greg. Thank you so much. And with that, we're going to transition to Isilda Dickerson from Ohio. Isilda, take it away.
Thank you. Greetings from the great state of Ohio. I am honored to represent the Ohio Department of Medicaid. And thank you to the SCAN Foundation for recognizing Ohio with the Pacesetter Prize for effective transitions. In Ohio, we have approximately 3 million individuals enrolled in our Medicaid program. In that composition, it represents 88 counties throughout our state, and we have a diverse population throughout Ohio. So we also make sure that we take and look at everything through a lens of health equity. And that health equity is important because not only do we want to ensure access, but we want to make sure that once someone has access services, that they also are able to have the quality of care that is person-centered. Mm-hmm. We have over 950 nursing facilities in the state of Ohio. So that means a number of residents are living in a congregate setting, but we want to convey the message of choice. So we also understand that some individuals may need, for health and safety reasons, to live in a nursing facility type of setting. However, there are those who want the choice to move and relocate back into the community. So we have in Ohio a home choice program where we've transitioned approximately up to 15,000 individuals to date. That average age range from over 50 to up to 80, and even we have some individuals who are in their hundreds. Mm-hmm. The actual centennials. So we are very proud to recognize that the efforts that we have put forth in Ohio around transitioning individuals to the community. But as my colleague has mentioned previously about family caregivers, we also acknowledge how important that is as well. So about 44% of those individuals that we've transitioned from nursing facility care to the community have actually went to the community under the supports of family caregivers and friends in their community support system. The other 56% have represented our 4 nursing facility level of care waivers. And one of our waiver programs in the nursing facility level of care arena is our MyCare waiver. MyCare is our dual eligible waiver for individuals who are enrolled in both Medicaid and in Medicare. So as I mentioned earlier, it's all about conveying the message of choice, being intentional about making sure that message is available and clear for everyone to know that they have choice. We also make sure that we use data and research. We use that data and research to translate to policy, but then we take that policy and we transition it into practice. So when we're taking and transitioning into practice, that represents how do we take it to the level of the individual. That individual deserves to have every need met, but based on what is for them, what is person-centered, and what is also culturally sensitive to their needs. We also want to make sure that everyone understands that when we're working with these transitions for individuals and going back into the community setting, as we look for opportunities in working with them, we also want to make sure that other needs are met wrapping around the services of housing and other social determinants of health. We also partner very closely, not only with community organizations, but we partner with our state partner sister agencies, which are the Department of Mental Health and Addiction Services, Department of Developmental Disabilities, Department of Aging, Department of Health. And we also recognize that we also need to partner with another array of services and institutions that also offer assistance to the community. And that is for those who need behavioral health services. Mm-hmm. We have a program called Recovery Requires a Community Program, in which we also assist in that program assists in transitioning individuals into the community setting where they can have their needs, as far as behavioral health needs, met as well. So I want to say that I am very honored to be representing on this panel today, the state of Ohio, also along with my colleagues from Connecticut, New Jersey, and New York. I'm looking forward to some great dialogue with all of us, and thank you for this opportunity.
Excellent. Thank you so much, Isilda. You know, I heard person-centeredness really at the core of everything that Ohio is doing. And that is, that's exciting. You know, I'm just listing out my P's of partnership and person-centeredness and supported by collaboration. And, you know, just congratulations to all of you. And as we just get started, before we do, I noticed that on our poll, we've got about half of our audience are folks from government offices and agencies all across the nation, which is exciting, as well as a lot of community-based players. So as we get into the Q&A portion, it's great to know that your colleagues are here and hearing your words of wisdom, both in terms of the things you've struggled with and the ways that you feel that success has really changed the game for you and the residents in your state. And so I think I'm just going to go ahead and tackle, you know, the hard question, but truthfully, I'd suspect the question that's on everyone's mind in this difficult period of time. The AARP scorecard this year, at the 2020 scorecard, as well as the Pacesetter Prize that we've given you as a state, all of the data for that was well before this pandemic hit. It looks at data over the last couple of years and synthesizes information across multiple years and really shines a light on your successes and the programs that you are championing forward. But then the COVID hit. COVID-19 has been present in our everyday and in every thought and decision for almost a year now. And I'd love to just hear from each of you, how has the COVID pandemic helped you put your state's work in perspective? And how do you think about what things might look like moving forward? And so we'll do a lightning round of about 2 minutes of each, and whoever like to start, please jump in.
Well, I will start. Perfect. In the state of Ohio, crisis, when you're in a time of crisis, we also acknowledge the fact that it takes clear, decisive leadership. And in the state of Ohio, our governor was intentional, and you'll hear me say those words quite frequently, intentional around ensuring that we had leadership that took the helm in making sure that we recognized that we were in a public health emergency. Some of us heard that we were in a public health emergency through watching the media and all of those types of things, but we were able in our state to hear from our leadership early on, this is a real crisis. We took that opportunity, and also under crisis, you also can identify with resilience. And so we took the opportunity to see what it is that we are also doing already to make sure that our individuals that we serve have health and safety as first and priority, but also to remove whatever barriers and what flexibilities we need to put in place for programs and services so they can continue to receive and have their needs met. We also recognize that there was a workforce shortage prior to going into the COVID-19 public health emergency. This pandemic just shined a light even further on that issue. So we want to make sure that as we continue through this pandemic and as we unwind throughout this pandemic, we're doing it in a way that we're conscientious about how do we continue to serve the needs of those that we need to make sure have health and safety.
Awesome. Leadership counts for sure. All right. Who wants to go next?
I can take a shot at that.
Great.
You know, I too have to applaud our state's leadership, our governor, our commissioner, our assistant commissioner who leads Medicaid in New Jersey, for having every expectation that we would continue the level of service to the extent that we could, whether we had to use different methodologies to deliver that service, to preserve continuity of care, to actually make use of every bit of flexibility that was offered by the federal government, to continue to support people in the community, and to not lose ground during this public health emergency. And I think we've been very successful at doing that. I think some of the bigger challenges are going to come as we unravel, because we are making those hard decisions about what flexibilities do we keep, can we keep. You know, we have learned the services can be delivered in many different ways. I think there's been a better respect for the importance of meeting social determinants of health, housing, food, and security, things like that. And we are beginning to look at those challenges now. They're not going to be easy. During a crisis, you have command and control. You have leadership that says you do these 10 things sort of this way. Now we really have to have some hard decisions to make about going forward. So I think that's about it from New Jersey.
Powerful. I think especially that idea about, what do you keep going forward, and what do you learn from it to transform care in totally different ways that aren't about before or about the now. So that's excellent. Right. All right, Dawn or Greg, who's next?
What do you think, Greg? You want to go next?
I was just trying to be respectful, so I can either go or go last.
Dawn, you're up, and then Greg, you get the last word on this.
Okay, I'm good. Thanks, Gretchen. Going back to March 9th, when the governor declared public health emergency, and I think that your question was, how did it help put work into perspective? I will say this. I never thought I thought I understood the responsibility that I had with respect to the older adults and people with disabilities in our, but I never truly understood that responsibility until March 9th, when every weakness of the system, I knew it. The lack of disease, infection control at a in a home, our inability to deliver PPE and keep people safe, including the informal caregivers, that all of those things came crashing down, or it felt like it, and every weakness was exposed overnight. And frankly, I'm sure for my colleagues, we didn't sleep, at least I know I didn't sleep for literally weeks, trying to address the weaknesses, find the strengths that we have in our system, quickly put in place the systems that we needed to put in place, which I will say, as after COVID, for generations to come, it won't be quite the same, because we know, now that we know what those weaknesses are, we will never allow them to repeat in the same way. We just know. And we learned it in that day. I had never personally been part of an emergency before. I mean, an actual emergency. And I didn't understand what that level of intensity was, 24 hours. But I will say, as everybody already said, our governor's leadership was amazing. And the team he put in place, they were listening. The right teams were put in place. We needed something, it was quickly response. We didn't have the frustration of not problem solved quickly. We were given the resources to be able to do that. So did we have weaknesses that were exposed? Yeah, and we can all probably talk for a long time about what they were that, were minor issues before, but became major issues on that.
That's right.
And our leadership was able to identify through listening, creating the channels, some of the things we've already talked about, Megan, like interdisciplinary teams and including public health. How do we teach them how to use it? How do we teach them? People, we never knew, many people never knew what the initials before March 9th. Now everybody knows what PPE means, right? And even how do we get our most vulnerable vaccines? Where are the sites? How do we deliver vaccines to the home? Where's those people? We could go on and on about this subject. But we've learned a lot, and some things will be better for it as we get a little bit distance from COVID-19 and the actual emergency. We've just learned a lot. So thank you for the question.
Sure did.
Absolutely. A lot of great thoughts in there. And I think the end makes me think about the idea of making a sweet batch of lemonade from an incredibly sour lemon. And with that, Greg, you get 2-minute drill to wrap us up with thoughts on New York.
Yeah, and I think, before we talk about New York, you have to just put your hearts out to the 400,000 plus people that have died, that we are still in the dark days, and, it didn't need to be like this. I think the three others had talked about good leadership, and the states that have had the good leadership, where they're not seeing the same type of response to COVID as other states. That's really unfortunate. But I think, in New York, obviously Governor Cuomo was on TV giving transparent, science-based press conferences every day to level with New Yorkers in terms of what we were dealing with, what we needed to do. But behind the scenes, what you don't see is we had, starting in March, going right through to the end of the summer, we had calls with 400 agency representatives every single day to map out assets, to be able to understand what we all did, how we can utilize the strengths that we all had, where there were weaknesses, could other people fill them in? And that's really what good leadership is about. I mean, the network that I oversee is so interconnected with the health system, the mental health system, transportation, housing, right? There, older adults don't live in the State Unit on Aging. They live in life, which crosses all the systems. But how proud I am to lead an agency like this on behalf of Governor Cuomo and be able to see how quickly this network retooled and did what they needed to do to meet the needs at the local level. And the key was being able to tell folks, I'm not going to get in the way. The bureaucracy is not going to get in the way. You tell me what you need and we'll figure out a way to get it. And we did that through executive orders. We were deemed essential. We were able to bypass regulations that don't make sense in a pandemic. Now, while we've never been in a pandemic, we've obviously gone through a variety of storms and ice storms and floods and things like that. So it wasn't our first rodeo, but so proud of both my network and really the state of New York, and being able to, again, map the assets, identify the gaps, fill in the blanks. And we are maintaining ourselves. We have met the need. We're continuing to do that. And as others had said, as devastating as all this is and heartbreaking, we are all going to come out of this better, because it provides us an opportunity to maintain those public and private connections, but also think about all the antiquated parts of our system, whether it be the Older Americans Act or whatever it may be. And this is the opportunity to make a change in those things that brings us into the 21st century.
Well, I just can't think of a better wrap up, and 4 amazing leaders to talk about as we move into the future, ways to bring us into the 21st century in an even more powerful way as these Pacesetter Prize winning states. Again, a huge congratulations to Ohio, Connecticut, New Jersey, New York, and a big thank you to the panelists, Isilda, Dawn, Carol, and Greg. Please know that this recording will be available shortly in email for all of you in attending, as well as the SCAN Foundation website. And it is my sincere pleasure and honor to be with all of you today. Thank you. Wishing you all an amazing weekend. And from here, with gratitude, we'll sign off. Thanks, everyone. Be well.
Thank you.
Thank you.
Thank you.
Congratulations, everybody.
Absolutely.
Indeed. Ditto.
Bye-bye.